I'd just kind of like you to share your thoughts of what you think. You know, paint us a picture of what is America going to look like under this health care law.
Well, Senator, number one, I just want to give you a lot of credit for leading this colloquy in regards to where we are 2 years from the passage of, it's hard to say what it is. Now it's ACA, the Affordable Care Act. It used to be PPACA. That was the acronym, which I thought was very appropriate. And then, of course, if you politicize it, it's called Obamacare. I don't mean to do that in this debate. But I do want to thank you for really focusing on jobs and costs. I do have some prepared remarks I'll get to pretty quick, but I want to thank Senator Kyle for CBO Truth. I think he ought to start a new program, that old one of Truth and Consequences, and you have pointed out the consequences that if you ask the CBO for a score, when you're going to try to pass a bill, they'll give you exactly what you want, but then the truth is, down the road, it costs an awful lot more. There's one person you left out in terms of the CBO telling the truth. That's Richard Foster, who's the actuary down at the Department of Health and Human Services. That man ought to get a Purple Heart, a Medal of Honor, and maybe not a Medal of Honor. We'll just give him a Purple Heart, maybe a Bronze Star for action in the action during the war zone, and then maybe a Medal of Freedom later. Senator Sessions, who is our resident bulldog on the budget, really hit it on the second counting, and thank you for that. That's a $500 billion. The other half of that is that it's a $500 billion that goes to all these exchanges and the rules and the regulations and setting up the Affordable Health Care Act, and basically it denies Medicare reimbursement to all sorts of folks: doctors, nurses, hospice, pharmacists, ambulance drivers, hospital administrators, on and on and on and on. We had a healthcare summit in Topeka, Kansas. 34 different regulations popped out of the woodwork, and we could have had 164, but we sent the 34 in to the Secretary of H2S. Then we went out to Hayes, Kansas, America, and that's really out there in the rural healthcare delivery system. We had seven different regulations. I hope later when we have a colloquy on regulations that we can certainly insert those in the record. Senator Bozeman, who is a physician, gave a standpoint of what happens in regards to rationing. Senator Bozeman, let me give your attention just a minute. Do you know who enforces this thing? At the end of the year, if you don't sign up, if you don't put on your tax return, which I assume it will be in terms of what kind of coverage you have, it's the IRS. The IRS is going to be the enforcement entity in regards to whether or not you have a provider, and if you don't, you get fined. Stop and think a minute about what's going on and all the waivers that have been going on in terms of who is enforcing this. Your friendly Internal Revenue Service, reinforcer. So yeah, I have a lot of feeling about this. I took the floor today to discuss something called promises made and I would tell the distinguished senator from Wisconsin, all the words that come back to bite you. And this one really has. That's the famous statement prior to passage of the health care reform law by the president: if you like your health care plan, you can keep it. Well, I'll give him credit. He may have believed it then, but as we have pointed out with Senator Kyle, Senator Sessions, Senator Bozeman, Senator Johnson, that's just not the case. I didn't believe it then, and I said so. Neither did Senator Sessions, neither Senator Kyle. You two are here now taking a good look at it. You don't believe it either. Why? It's pretty simple. Employers and health care providers told me that when the majority of the provisions of the health care reform law would take effect, it would be more affordable for an employer to simply stop offering their employee coverage and pay a penalty rather than face the predictable increase in premiums and to continue to offer any coverage. Now these predictions have turned into facts. A new study just released by a McKinsey & Company, a consulting company, predicts large numbers of workers will be shifted into the health exchanges in 2014. And that's a shift that folks should be worried about. Exactly what you're talking about, Senator Johnson. Literally thousands of regulations and waivers are pouring out of the Department of Health and Human Services. In fact, to date, 12,307 pages of additional regs to restrict personal freedom and micromanage the private market. And to make matters worse, there is the predictable worry that the exchanges would be better described as something similar to Medicaid HMOs. That's the kind of service that we could expect to get. And that threatens access, choice of doctors, not to mention the rationing regime that will be the marching order of the day, and I'll have a lot more to say about that in a colloquy in the next several days. At the time the President made his promise, the CBO estimated, as Senator Kyle pointed out, that only about 7% of employees covered by employee-sponsored insurance would make the switch or be forced to switch to taxpayer-subsidized exchanges. Now, I would tell the Senator, study after study is releasing facts and figures that find the health care reform law will cause many or even most employers to quit offering their current health insurance. And in a survey by benefits consultants at Lockton, when asked about the cost of notifying employees or changes required by or resulting from health care reform law, they said each notification will cost $1 to $3 per employee. Now, you want to talk about costs. This would raise costs by tens of thousands of dollars or more for some firms, and nearly 1 in 5 firms is considering terminating coverage outright thanks to the law. Each study, the numbers go up. The McKinsey survey found that 45 to 50% employers say they will definitely or probably pursue alternatives to their existing health care plans. 30% of employees will simply stop offering any coverage. So those are the facts, and there are more to come. I would just simply say, I'm going on too long here, and I understand that, but I would simply say again, I want to thank my colleagues. Contrary to this administration's belief, there's no such thing as free health care. Somebody does pay. And in this case, the American taxpayers will be forced to foot the bill for workers whose employer-sponsored coverage has been dropped due to the health care reform. And there was another quote I'd like to mention, and that it should be the subject of another colloquy. There's absolutely no rationing in this bill. It's just scare talk. Want to bet? There's nothing that hurts the truth than stretching it. And with PPACA or ACA or Obamacare, jobs and costs will be stressed beyond the limit. And I truly thank the Senator for sponsoring this colloquy.